is Christy, and I'm going to be your student nurse for today. Okay, I'm just going to show my paper before I begin. Here's the front. Here's the back. Okay, I'm just going to start off with just washing off my hands. How are you doing today?
Good, thank you.
That's good to hear. What brings you in today?
I have my stomach hurts.
Oh, you have stomach pain. Could you tell me a little bit about it?
It's like a sharp pain. It started hurting a couple days ago.
Okay, let me assess you a little bit more. I'm just going to put on my gloves, and I'm just going to provide privacy. Okay. You said you had pain. Could you locate it for me?
Right here.
Right there? Okay. And what makes it better and what makes it worse?
When I lay down, it makes it better. It makes it worse. I don't know, throughout the day, sometimes it hurts.
Okay. I'm just going to start by getting your full name and date of birth. I have your wrist. Okay. Can I get your full name and date of birth?
Mary Flores, September 8, 1990.
Okay. And that makes you how old?
I am 29 years old.
Okay. And what is your marital status?
I'm married.
Okay. And your occupation?
I don't work. I go to school.
You don't work? What about any allergies? This includes latex, food, seasonal. No allergies? Alrighty, thank you. Okay, you said you had stomach pain, and what did you say made it better and what made it worse?
When I lay down.
Made it down. And what made it worse?
It should makes it worse throughout the day.
Anything makes it worse?
Nothing.
Okay. What about relief measures? What do you take for this pain?
I usually just lay down to relieve my pain.
Okay, and does it radiate anywhere?
No, just my stomach.
Alright. From a scale from 0 to 10, 0 being no pain and 10 being the most pain you have, how would you rate your pain?
It's at a 5.
Okay. And does it come and go or is it constant?
It comes and goes.
Okay. And what aren't you able to do because of this pain?
Sometimes I have to take a couple breaks throughout the day just to lay down.
Okay. And is this the only pain you have or do you have any other pain?
No, this is the only pain I have.
Okay, thank you. Alright, so I'm just going to go ahead and ask a few more questions if that's fine. Okay, have you ever been diagnosed with any chronic illnesses as a child, like measles, mumps, or the chickenpox?
No.
Have you ever been in any auto accidents or major burns, for example, car accidents, burns, or head traumas?
No.
Okay, and what about any chronic illnesses? Have you been ever diagnosed with diabetes, hypertension, asthma? No? Okay. Okay, what about in your family? Has anyone in your family been diagnosed with hypertension, diabetes, asthma?
No.
No? Okay. And can you tell me a little bit about your parents? Are they both here? Your biological parents? How old are they?
35 and 45.
Okay. And how would you say their health is?
They're pretty healthy.
Okay, that's good. Alright, just gonna ask a few more questions about yourself. What is the last grade you completed?
Some college.
Okay. And your occupation, is your lifestyle, is your financial status adequate for your lifestyle?
Yes.
Okay. And do you have any religious practices that we need to be aware of?
No.
Okay. And what about any self-care behaviors that you do for stress or anything like that?
I usually just take walks.
Take walks? Okay, that's good. Okay, what about your sleep patterns? How well do you sleep at night?
I sleep good at night.
All 8 hours? Okay. Do you take any naps during the day?
Sometimes when my stomach hurts.
Okay. On a typical day, how would you say you spend a day?
I usually wake up, eat, and I go to school, then I eat again for lunch, and then I go to school, and then I come home and eat again, and then I do homework and go to sleep.
Busy day, huh? Alright, thank you for that. These following questions are going to be a little bit more invasive, but just be as honest as possible, okay? This is just to give us more resources for you if you need the help, okay? Alrighty. Do you drink alcohol?
No.
Okay. If you
Oh yes, I actually do.
Oh, you do? How many times in a typical week? How many days a week do you say you drink?
I drink once.
Once a week. And on a typical day, how many drinks do you have?
Just 1 can.
1 can? How would be the can? Like how many ounces?
It's like 8 ounces.
8 ounces. Okay. And do you feel the need to cut down?
No.
Do you feel annoyed when people tell you you need to cut down?
No.
And what about guilty? Do you feel guilty when you need to?
No.
Okay, and what about, do you need an eye opener in the mornings to get you started?
No.
Alright, thank you. Okay, a few more questions. Since domestic violence is so common in our community, we're asking you to get on individuals these questions. Do you feel safe at home?
Yes.
Okay, are you afraid of your partner?
No.
Okay, if she would have said yes, I would go ahead and perform a danger assessment. Okay, over the last 2 weeks, have you felt down, depressed, or hopeless?
No.
Okay, what about in the last 2 weeks, have you felt little pleasure in doing things?
No.
Okay. If she were to say yes, I would go ahead and do a PHQ-9 and ask her the following questions. Do you feel like life is not worth living?
No.
And do you have a plan to hurt yourself?
No.
Okay, thank you. Alright, so then we're just gonna go on to the mental status. Okay, so I can see my patient, her posture is erect, she's not slumped over, her body coordination is appropriate. She is well groomed and hygiene, and she's groomed appropriate to the weather. Behavior, my patient, she's alert, her speech is not slurred, it's clear. And then cognitive, she's aware to person, place. Do you know where we're at right now?
Yes, we're at the hospital.
Okay. Do you know what year it is?
Mm-hmm. It's 2020.
Okay, so she's oriented to place and person, place, and time. She also has good attention span because she doesn't get distracted easily. She has recent and remote memory because she's able to tell me past events and future events. And then T, thought process, she does make sense, and she's not suicidal because I did perform the suicidal screening. Alrighty, thank you for that. I'm gonna go ahead and do the physical part of the exam. Okay, if you have any questions, again, just let me know, okay? Okay. So now I'm just gonna start off with the head. I'm just gonna go on to palpating it and seeing the texture of the hair. Okay, so the texture of the hair is thick and it's evenly distributed. I don't see any patches. Okay, I'm just gonna go ahead and palpate the skull. Okay, I'm just gonna palpate the skull for any lumps, protrusions, abnormal depressions. Okay, I didn't feel any abnormalities. The head is symmetrical, it's round, normal cephalic, and it's appropriate to the body size. Now I'm gonna go on to the eyebrows. The eyebrows are symmetrical and they're even. I'm gonna go on to the eyes. As I'm seeing the eyes, I'm gonna go ahead and look for any redness around the eyes. Gonna have you close your eyes. Okay, so then when she closes the eyes, the eyelashes are evenly distributed. There's also no redness around the eyelashes or swelling. Okay, can you open them? Okay, again, looking at the eyes, I can see there's not any protruding in the eyes. That would be exothalamus, or sunken into the eyes. That would be endothalamus. Okay, and then now I'm just gonna be checking the sclera and the conjunctiva. Okay, so the sclera, I can see it's white and glossy, and then I'm just gonna pull down on the conjunctiva. Okay, and I can see it's pink and moist. There's no drainage. Alrighty, thank you. Okay, so then now I'm just going to perform PERLA. Okay, I'm just going to be looking at direct and consensual light. Okay, direct light's the eye that I'm going to put the light into. Consensual is the pupil that dilates along with that eye. I'm going to just have it look straight. Okay, before doing that, I'm just going to measure. Okay, so she's at around 4 millimeters. Okay, so the other people did dilate as well, and I would say it went up to 3 millimeters. Okay, now I'm going to go on to accommodation. Okay, can I have you look at the pen? Not moving the head. Okay, so the eyes did accommodate. Okay, so then the PERLA is pupils equal, round, reactive to light, and they accommodate. So that's well. I'm going to go on and do the nasolabial folds. Can I have you smile for me? Okay, so I can see the nasolabial folds are symmetrical as she smiles. I'm gonna go on and move to the oral cavity. Can I have you open your mouth for me? Okay, I'll be looking at the gums to see if there's any lesions. It's pink and moist. Can you stick out your tongue for me? Okay, tongue is pink and moist as well. And then I can see the lips, there's no cracks, and it's pink and moist as well. Okay, so now I'm just gonna go ahead and perform a sensory motor and smell test. Okay, can I have you close your eyes for me? Okay. And then whenever you feel a touch, can you say now?
Now. 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 Now.
Okay, good job. With your eyes still closed, I'm gonna do the smelling. Okay, I'm just gonna put one nostril. And just tell me what you smell. Okay.
Mint.
Okay. What do you smell?
Orange.
Okay. Good job. Ready? Okay, can I have you puff out your cheeks for me? Okay, so as I puff up the cheeks, the air went out symmetrically as well. Okay, I'm gonna go ahead and, can I have you cough? Can I have you swallow? Okay, and then I'm gonna have you gag. Okay, so she was doing good on that. So now I'm gonna go on to the ears. I'm gonna be checking the ears to see if they're equal bilateral. I'm not gonna check each one individually. I'm going to be checking for, to see if the skin is intact. I'm gonna see for any redness, swelling, and external meatus. I'm gonna be looking at the cerumen. I will document the mount and the texture, the color. I'm also gonna be looking at the opening. Okay, I'm gonna look at the other ear. We'll do the same. The skin intact. I'm gonna be looking at for any redness, any swelling. The opening of the ear as well, it's symmetrical to the other one. There's no cerumen present. If there was, I'll document the mount and the texture. All right, and then I'm gonna go ahead and do any tenderness. Okay. I'm gonna do both ears. I'm gonna just pull up and back. Do you feel any pain here?
No.
What about here?
No.
I'm gonna push down on the trachea. Do you feel any pain here?
No.
And then it is right here. Okay. All right, so that's good. Now I'm gonna go on to the neck, and I'm gonna just look for any jugular vein distension. Can I have you turn to to the left? All right. There's no signs of jugular vein distension. Now I'm gonna go ahead and palpate each artery. Can I have you turn again? Okay, 2+. The other side. 2+, and then in grading, of course, 0 is absent, 1 is weak, 2 is normal, and 3 is full and bounding. Okay, now I'm just gonna go ahead and auscultate. And when I do this, can I have you breathe in, breathe out, and hold as I put it on there? Okay. Okay. Now return, and then breathe in and out. There's no signs of bruise. I'm gonna go ahead and go on the other side. Okay, and just do the same. Okay, again, no signs of bruising on there. One more on the neck. I'm gonna have her do some range of motions. I can see that her neck is midline and erect. Okay, I'm gonna have you just do some range of motions. Okay, can I have you look down? Up, to the side, and then ear to the ear, and then ear to the ear. Did you feel any pain while doing any of this? Okay, thank you. Okay, so now I'm just gonna go on to rating the pulses. Okay, I'm gonna just do the brachial, the brachial. Okay, 2+, the ulnar, the radial, 2+, the ulnar, 2+. The radial 2+, the ulnar 2+, and then I would do also the femoral, but not on this one. And I'm gonna do the popliteal. Okay, this one's usually not felt, but would be 2+. The dorsitalis pedis. We'll start serratibulus, 2+, the dorsal pedis 2+, and the posterior tibulus 2+. Alrighty, so there's all the pulses. Now I'm gonna go ahead and I'm going to listen to her heart. Okay. And this is gonna be the aortic, the pulmonic, aortic. Yeah.
Mm-hmm.
Okay, I'm just gonna go on to the aortic, the pulmonic, the iris point. Can I have you raise up your breath? The tricuspid, and then the mitral. Okay, I think sounds strong over there. Then I'm gonna go on to do respiratory. Okay, I'm gonna have you just breathe in and out. Usually we would listen for 3 minutes. Okay. Okay, so breath sounds are they're clear. Now I'm gonna go ahead and look at respiratory rate. Okay. I'm just gonna do respiration starting right now. I got 10. 10 times 2 is 20, so it's between the normal ranges of 12 to 20, so that's good. The respirations, her rate was evenly paced, and the pattern was constant as well. Okay, while I'm here, I'm also going to be looking at her her sternum. I'm going to be looking for pectus excavatum, which is protruding of the sternum, and I'm going to be looking for pectus carinatum, which is protruding of the sternum. Okay, I can see there's none present. I'm also going to be looking for chest diameter. Normal AP diameter is 1 to 2. Anything like 1 to 1 would be like a cause of chronic emphysema or COPD. Okay, so the AP diameter is 1/2. Now I'm going to go ahead in the back, and I'm just going to be listening to breath sounds in the back. Okay, and then now I'm just going to be listening to the posterior. Okay, again, one full cycle. Breathe in and out. Yeah. So breath sounds were clear. Okay, there's no signs of crackles or wheezing. Now I'm just going to go ahead and do the coastal verbal tenderness. Okay, just tell me if you feel any tenderness.
No.
No? Okay, now while I'm back here, I'm also going to be doing tactile phrenitis. Okay, as I move, can you say 99 for me?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, so there's normal vibrations in all quadrants. Now I'm just going to go ahead and do the chest expansion. Okay, I'm just going to go on to the 12th rib. Okay, I'm going to have you breathe in and out. Okay, so there was even chest expansion as well. Okay, thank you. Okay, I'm going to have you go front for me. Okay, so now I'm just going to go on and do range of motion while I'm here. I'm going to start off with the temporomandibular joints. Okay, can I have you open and side to side? Okay, anybody cramped this, any pain?
No.
Okay, I'm gonna do shoulders. Can I have you go up and down? Okay, any pain?
No.
Okay, and can I have you go back right here? Okay, and then go do this for me as well. In the back, touch your head. Okay. Alright, so that she can do a complete range of motion while doing that. Alright, any pain while doing that?
No.
Any crepitus? Okay, I'm gonna have her go against my fours. Okay, and then I'm gonna have you do the elbows. Can I have you do both elbows like this? Okay, I'm gonna be checking for pain, for crepitus. Any pain?
No.
Okay, and now I'm gonna have you do the wrists. Can I have you go up and down, side to side? Okay, no crepitus. Any pain?
No.
Okay, I'm gonna have you do the fingers. Okay, any pain like that?
No.
Okay, I'm gonna go on and do the knees. Take out for me one at a time. Okay. No crepitus, any pain?
No.
Can I have you go against my fours? No. Okay, and I'm gonna do the ankles. Any crepitus here?
No.
Okay, I'm gonna do the other one. Okay, any pain?
No.
Okay, and then I'm gonna have you go against my fours on the elbows and back. Okay, and now I'm just gonna go on to elimination. Can I have you lay down for me, please?
Mm-hmm.
Alright, I'm just gonna get my okay, I'm just gonna get my paper. Okay. When was the last time you've had a bowel movement?
This morning
This morning? At what time?
at 8 a.m.
Okay. And how would you say it is? Like the color
It was brown.
and the consistency?
It was like solid.
Real solid, okay. And the smell?
Normal smell.
Almost smell. Okay, and if I would, these would just be the questions and the characteristics I would look for in the stool if it were to be present. I would look for the smell, the odor, the amount, the characteristics, any abnormalities, stuff like that. Okay. Alrighty. Now I'm just gonna go. I'm just gonna go and look at the quadrant. Okay. Right here, in the lower right quadrant, we have the appendix. The right upper, we have the liver. The left upper, we have the stomach. And the left lower, we have the descending colon. And I'm just gonna, before starting anything, I'm just gonna shine my light over the quadrants. Okay, and usually the shirt would be up, but I'm just gonna be looking for any striae, any venous patterns. I'm also gonna be looking over any pulsations over the major arteries. Okay, and I'm also gonna be looking at the contour to see if it's flat, scaphoid, protuberant, or round. Okay, I can see it's flat. Alrighty. Now I'm just gonna go ahead and I'm going to here in all four quadrants. Okay, I'm just gonna put this over here. Okay, I'm just gonna hear in all four quadrants. The bell sounds. Okay, so there was normal active vowel sounds in all four quadrants. Now I'm going to just, I'm going to palpate each quadrant. I'm just gonna be looking for distension, tenderness. Do you feel any tenderness in any place?
No.
What about right here?
No.
Okay, now I'm just gonna percuss in all four quadrants. And also the midline. And midline would also be the bladder. While I was percussing, I felt tympani. Dullness would be over mass or a distended organ or fluid. Now I'm just gonna auscultate the major arteries. Okay. And then we have the aortic, the right renal, the left renal artery, the right ilium, the left ilium. Okay, and then we also do the femoral, but we're not going to do this in this scenario. Okay, so there was no bruits present. Okay, so I'm going to have her, I'm also going to do the iliopsoas test, which is going to be the indication of appendicitis. Okay, can I have you raise your right leg against my force? Okay, did you feel any pain in the right lower? No? Okay, so that's good. Now I'm going to be doing the shifting duodenus. This is going to check for ascites. Okay, I'm going to start with the part that would be tympani and go where I would hear duodenus and mark it. So I'll just tap all the way until I hear anything of duodenus. And then I would mark it right here, and then I'll have my patient turn over, and then I would do the same. Okay. And then I would just go down again with a tympani until I hear duodenus. And then until I feel it, and then I would mark it duodenus again right here. So on this occasion, she doesn't have it, but that's how we would do that test. Alrighty, I'm gonna have you sit down for me. Well, we're gonna go ahead and we're gonna be doing the vitals and all that. So before doing that, I'm gonna have you walk from right here, extend 20 feet from the Snellen chart. Here. Let me just see. Okay. I'm gonna say this is 20 feet right here. Okay, can I have you cover, okay, yes. Can I have you cover your right eye and tell me the smallest line you could read?
Okay, it is LPED.
Okay, and then can you cover the other eye and tell me the line you could read?
LPED.
Okay, so, and then both eyes, could you read the same line?
LPED.
Okay, so with both eyes, she has 20/50. Anything lower than 20/30, I'll refer her to an ophthalmologist. I would also note to see if there's any squinting, any leaning forward, or missing of the words. Okay, so that's good. Now I'm gonna go ahead and I'm gonna have you walk from right here over here with one foot over the other. Okay, I'm going to be watching for her gait, and I saw there's not any stumbling, any shuffling. Okay. Alright, so now I'm just going to go ahead and we're going to wave. Okay, can I have you stand right here? Okay, so then I got you wait. Okay, can I have you step off for me? Okay, and then can I have you step on looking this way? Okay. And then I'll go ahead and I'll document the height. Okay, what's your usually height?
5'1".
5'1", okay. So then I'll document that. And then while she's here, I'm also gonna be doing the circumference. Okay, can I have you step off for me? Okay, we're gonna do the circumference. Okay, just gonna go around you. Alright, and I got 36 inches. Okay. There we go. Okay, now can I have you sit down for me, please? Okay, I'm gonna go ahead and write this down. Okay, and I'm gonna go ahead and calculate the BMI. We got 61 inches for the height and 160 for the weight. Okay, and I got 30.2 for the BMI. Alright, before sitting down, if I do a few range of motions, can I have you stand up for me, please? Okay, we're gonna do the hip. Okay, I'm just gonna have you go to the side and the side. Do you feel any crepitus?
No.
Okay, what about any pain?
No.
Okay, and then can I have you touch down and touch your toes? Okay, I didn't feel any crepitus. Did you feel any pain?
No.
Alrighty, thank you. Okay, can I have you sit down for me now? Alright, so now we're just gonna go on to assessing the body, and I'm gonna be just looking at her color. It's appropriate for her background. I'm also gonna be looking for any wounds, lesions. Do you have any wounds, lesions present?
No.
Okay, if she would have wounds, any wounds, I would look for the location, the size, the exudate, which would be like the odor and the color. If she had any lesions, I don't see any lesions present, I would document the symmetry, the border, the color, the diameter, less than 6, and the elevation. Okay. And now I'm just gonna go ahead and look at muscle, look for warmth and all that. Okay, I'm just gonna palpate. Okay, I'm just gonna be touching for any tenderness. Do you feel any tenderness here? What about here?
No.
What about here? No?
No.
While I'm down here, I'm also going to be checking for any edema. Okay, the next ankle. And then on her wrist as well. Okay, there's no edema, but if there would be present, I would grade it 1 mild, 2 moderate, 3 deep, and 4 very deep edema. I'm also going to be looking at her warmth. Okay, she's warm to the touch. She's not diaphoretic. I'm also going to be looking for muscle symmetry, muscle tone. Okay. Both sides are symmetrical on her muscles. Now I'm just going to go on to her nails and look at capillary refill. Okay. Capillary refill is less than 2. Also on here, I'm going to be looking for any clubbing and the contour of the nail beds. It's pink, round. It's not bit into the quick. Okay, there's no signs of clubbing as well. I'm also going to be looking for any hair growth on the extremities. Okay. Now I'm just going to be asking and assessing a few more questions. Okay. Alrighty, so as my patient, I can see that her face isn't drooping. I had her smile and both sides were symmetrical. Arm weakness, can I have you go like this for me? Okay, there's no signs of arm weakness. And then she didn't have slurred speech. She was able to talk to me appropriately. If she would have had any of these symptoms, I would go ahead to go to the acronym EMT and call 911 because this would be a sign of a stroke. And then for the glaucoma scale, I can see that she opens her eyes spontaneously. So I'm gonna give her a 4. She's able to obey commands and body movement, so I'm gonna give her a 6. And her speech isn't slurred, it's not rapid, so I'm gonna give her a 5 for clear speech with a total of 15. Anything less than 7 would be considered a coma. Okay, I'm just gonna ask you a few more questions. Are you able to feed yourself?
Yes.
Yes, you don't have trouble putting food in and out of the mouth?
No.
Okay. What about bathing yourself? Do you have any trouble getting in and out of the shower?
No.
Okay. What about dressing yourself? Do you have any difficulties with buttons or zippers?
No.
Okay. And what about continence? Are you able to go to the restroom and not have any accidents?
Yes.
Okay. And what about toileting? Are you able to go to the restroom, able to clean yourself?
Yes.
Okay. And what about transferring? Are you able to go in and out of your house without any help?
Yes.
Okay. So that's a total of a 6, which means you're very independent. Okay. Alrighty, I'm just gonna go ahead and do another test. This is just a hearing test. Okay. Can I have you close your eyes for me? Okay, and then whenever you hear something, can I have you point to the side where you hear it from? Okay, she was able to pass the hearing test, and I could also know that she could hear because she was able to respond to my questions, and I didn't have to repeat myself while I was asking her. I'm just gonna check to see if I have anything. Okay, I'm gonna go ahead and do the vitals. Okay, normal respirations, we did with normal respiration, it was total 20. Now I'm just gonna go on to temperature. Average temperature is 96.5 to 100.4. Okay. Temperature. See what happens. Okay, got 98.6. Okay, between the normals. Now I'm just gonna do her pulse and her oxygenation. Okay, I'm just gonna clean this off. I'm gonna make sure she doesn't have any nail polish. Okay, anything that would affect the reading. Have you ate anything in the past 30 minutes that is cold or hot? Okay, have you smoked? Ran, did any exercises?
Yeah.
Okay. Okay, just gonna put your finger, just relax. Okay. You got 95 on oxygenation. Normal was 95 to 100%.
Can I get some water?
Yes.
Thank you.
Go ahead. Okay, oxygenation was 95%, pulse was 90, so that's normal, it's between 60 to 100. Okay, now we're just gonna go ahead and do your blood pressure. Do you have any PICC lines that I need to be aware of? Okay, any surgeries on either side? Okay. Alright, I'll have you, let's see what we can figure out. Is this one fine? Okay. Just gonna lift up your shirt. Yeah, that's not. Alright. Okay, so I'm just gonna do the two-step method. Let me just relax. Okay, I stopped hearing it at 110, so I would go up to 140. Then I would wait a full minute. Did your arm feel fine? Okay, so I'm gonna go ahead and do it. Okay. Let me just put your right hand. Okay. You ready? 80, which is in the normal, below over 20, you're 80. Okay, let's put this over here. Alrighty, move this right down. Okay. Alrighty. Okay, I'm just gonna go back onto muscle strength. Okay, I'm gonna have you pull my fingers. Okay, and then can I have you go against my force on the bottom? This is gonna test for lower extremity. Okay, so that's good on that. Okay, so everything is good on this one. Okay, so that is the end of my checkoff.